Did that all
We are
last
live.
night?
Good morning, ladies and gentlemen. We will call the meeting of County Council to order for the January 2021. And we have a resolution.
Resolved that council resolve itself into committee of the whole closed session as authorized under section 239 of the Municipal Act to consider adoption of the closed minutes of meeting held December 16th, 2020. Position, plan, procedure, criteria, or instruction to be applied to any negotiations carried on or to be carried on behalf of the municipality or local board as it relates to negotiations with MTO and the Township of Frontenac Islands regarding the operation of the Howe Island Ferry. And 3, a position, plan, procedure, criteria, or instruction to be applied to any negotiations carried on or to be carried on behalf of the municipality or local board as it relates to Ontario Health Team.
Any discussion? All in favor? Oh, I guess, okay, that's fine. Yep. Carried. I can see everybody and it's in real time, so that's carried. I guess we're going to leave then, right?
Yes, you can move over to the closed session now, and we will put up a slide here letting everyone know that you will be in closed session.
Where do I go up here?
We'll see if we come back in 5 minutes or not.
Hi, Ron. I see you on, but I don't see anybody else. Do you have others? My screen format seems to be different.
Ron as in me or
Uh,
Ron as in Higgins?
Yeah, Ron as in you. Is the other Ron
Okay.
on?
Dennis,
Yeah.
they're all on. It's just because we're screen sharing the closed session. Once that goes away, you'll be able to see everyone again.
Oh, thanks for clarifying that.
Yeah, I
I
was
feel
getting
better.
nervous.
So, yeah.
Can you hear me, Ron?
Yes.
Okay, that's what I wanted to know because I had my microphone turned off. I know you'd rather look at me than hear me.
Well, I was saying hi to your wife, but
Where?
standing over your shoulder telling you how to do things.
I had a problem with my hearing aid went dead
Just a
between
reminder
meetings.
that we are live.
So,
Okay. Rita says we are live. So we have a resolution coming out of closed session.
So I have it here, moved by Councillor Martin, seconded by Councillor Ravel. Resolved that council rise from committee of the whole closed session, that procedural bylaw 2013-0020 be waived, and that the warden report.
Any discussion? All in favor? Carrie, Kelly, are you going to rise and report?
I have the other closed session
Okay,
here as well.
sorry,
No problem.
sorry.
Moved by Councillor Higgins, seconded by Councillor Higgs. Be it resolved that the warden and clerk be authorized to execute a memorandum of understanding with the Township of Frontenac Islands for the day-to-day management of the Frontenac Howe Island County Ferry, and further that staff be directed to implement changes associated with the memorandum of understanding.
Any discussion? All in favor? Carrie? Approval of addendum?
We have no addendum.
No. Okay. Any disclosure of pecuniary interest in the general nature thereof? None? Adoption of minutes.
I have it here, moved by Councillor Smith, seconded by Councillor Higgins. Resolved that the minutes of regular council meeting held December 16th, 2020 be adopted.
Any discussion? All in favor? Carried. Deputation and or presentations. And we will start off with University Hospital Kingston Foundation and welcome Abigail McQuilham.
It will actually be Mr. Tom Sloanay presenting today.
Pardon?
It will actually be Mr. Tom Sloanay presenting for University Hospitals in Kingston.
Okay.
Thanks. Thank you
I
for
guess-
having us. We're going to have Sue Creasy do a little introduction first, and then Tom will do his presentation.
Okay, go ahead.
Can you hear me?
Yep.
Yep.
Great. Good morning, members of council. My name is Sue Creasy, and I am the volunteer campaign chair for the UHKF. I have the pleasure of joining you this morning to make some introductions before presentation from the University Hospitals Kingston Foundation. First of all, thank you everybody for giving us the opportunity to provide you with an update on the Kingston Hospitals this morning. Our mission at UHKF is to inspire generosity for the health of our families, our region, and beyond. We would like to begin by thanking Frontenac County for being a remarkable example of our mission in action through your commitment of support and generosity. Your pledge has demonstrated considerable leadership among the surrounding counties in southeastern Ontario. As a resident of South Frontenac, I am very proud to say that we are all supporting this redevelopment project. As a reminder, in 2018, the Frontenac County Council approved $550,610 pledge and support, of which $110,122 of this has been paid to date. Your generous gift was directed to the redevelopment at Kingston Health Science Center at the KGH site. Like so many communities across the country, healthcare providers in Kingston face the challenge for caring for an aging population while also addressing the rise in chronic disease. Complicating the situation is the immense pressure placed on our facilities. Technological advancements have led to 21st century medical equipment being squeezed into 19th century, 1954 constructed surgical suites. This has been the reality at Kingston Health Science Center for far too long. Given the magnitude of work to be done, the next phase of Kingston's healthcare modernization has the potential to touch every citizen in southeastern Ontario. This is an ambitious project, but with the incredible support of our community, like your support, together we can accomplish great things. I'd also like to introduce Tom Zolnay, our CEO of the University Hospitals Kingston Foundation, and our presenter this morning. Tom came to the foundation in the summer of 2019, but unfortunately, due to the timing, he has spent most of his time working under the conditions imposed by the pandemic rather than without it. This has made it difficult for us to get out and meet our friends and supporters, which makes us especially grateful for the time you are providing us this morning. We are fortunate to have Tom leading our foundation, as he is a seasoned fundraising professional, directing projects that have raised over $295 million over the past 3 decades. He began his fundraising career with Navian, a consulting firm that supported clients across Canada, and from there went on to lead fundraising and alumni relations teams at Concordia University, Laurentian University, and the University of Victoria. Tom has also served as an infantry officer in the Canadian Armed Reserves, retiring with the rank of colonel in 2014. So without further ado, I will turn the meeting over to you, Tom, and thank you very much, Council, for this opportunity.
Thank you, Sue. I will attempt to share my screen. Hopefully I get it right this time. There we go. Did that work?
Yep.
So far.
Awesome. All right, so I will of course give a little bit of an update on redevelopment. First, I thought I would cover how the hospitals have been dealing with the pandemic. I guess the first bit of good news is that it's been exemplary, and we are kind of a model for the rest of the province in terms of how to deal with a pandemic. Both hospitals were listening to the news coming out of China in late December, early January, and we're already starting to think of plans on how to deal with what might come. And then with the cooperation that exists in this area, and with not just between the hospitals, but with all the healthcare providers, including public health, of course, we were able to move quite swiftly. And as a result, with the fact that there's a lot of shared facilities or services as well, including infection control, the ability to keep the infection out of our healthcare facilities has been one of the sort of highlights of how well the various organizations have dealt with keeping their residents or patients safe. So we as also because of our geography, have had the good fortune of being well spaced out, so the virus was not able to take its foothold here as it might have in more crowded centers like Toronto or Ottawa. None of the breakouts that we've had in any of our healthcare facilities were linked to patients getting sick from, or for that matter, from healthcare workers getting sick from patients. It's all been cases where they've picked it up in the community somehow and got caught through our screening processes and therefore never actually got it into the facilities. We are also one of the few jurisdictions in the province where both hospitals maintain their pandemic supplies. So although there were some concerns about PPE because the supplies that were maintained were perhaps not as large as what would have been required to deal with COVID, there was never an instance where our people in the hospitals went without. Kingston Health Sciences Center very early on at the sort of mid-March started to work on their preparations. They included decanting all kinds of patients to long-term care and to Providence Care Hospital. 23 of those almost immediately went to Providence Care, which increased the capacity of the hospital to be able to take in patients should COVID hit in our region. They stopped elective surgeries. Now, elective is perhaps the wrong term, since for the person who's on the list, it's not necessarily considered elective. These are still important procedures to keep people healthy. However, it was necessary in order to ensure that the capacity was there as the pandemic continued. They also planned for multiple contingencies, including a field hospital over at the Invista Center, which thankfully never had to be used. The laboratory at the KHSC developed its own test to look for the virus, and it was one of only 8 hospitals in the province that was authorized to do that. And I'm happy to say that it's one of the most accurate tests that is being done, and it's also one of the quickest. The turnaround time for a test that goes through the hospital lab is between 12 and 24 hours. So if a patient comes in, we know very quickly whether or not that person is infected. And then, of course, they also created a COVID unit on Connell 3. Over at Providence Care, there was also some preparations underway. Providence Care is normally a 270-bed hospital. They added 203 beds, 29 of those on units, and another 174 in non-traditional spaces, including in its large Founders Hall, which is usually used as a meeting area. Also started to rethink how they were going to deliver their community programs to the point where in some cases they were issuing technology to some of their patients so that they could continue with virtual visits. And there too, and there's been no real cases of COVID within Providence Manor. All the residents there were kept safe throughout the duration of the pandemic. Now, as I said, elective surgeries are not necessarily so elective, and there was concern all through the period where those were being postponed that the patients were potentially getting sicker. And so our medical practitioners are all constantly lobbying to get that back up and running. And once the restrictions started to lift, KHSC moved fairly quickly at starting to bring those back online. At Hotel Dieu, it has now been declared an inpatient hospital once again, now with limitations, mind you, and 42 inpatient beds are up and running since November, and there are 12 more that should be up and running by the end of this month. The first admissions happened on November 10th, and last week we were celebrating the 100th patient going through Hotel Dieu. So that is helping to clear some of the backlog, and it also means that more complicated surgeries can be done in KGH, so that more can be funneled through as we go. The new term for a field hospital is an alternate health facility, and that is being set up over in the old St. Mary's of the Lake property, or now being called the Union Street property, so as not to confuse people. It belongs to Queens. Providence will be running the logistics of that building, but the alternate health facility will be on the ground floor, and there'll be up to 70 patients that could be accommodated there. Hopefully it doesn't get to be used, but it's there in case a contingency is required. Over at the other 2 floors, Providence Care is actually in looking after that. That's going to be a transitional care center, and actually it's intended to stay up and running for quite a number of years. It's not just a pandemic response. And transitional care is that care that you need if you no longer need full-on acute care in an acute care hospital, but you're not quite healthy enough to go home on your own. Transitional care is that in-between period, and so they'll be setting up 2 floors there with 64 beds total. And as I say, that will go on for some time, and it'll open sometime this year as soon as the renovations are completed. As I mentioned, now belongs to Queens, and it hasn't been used for some time, so it does need some cleaning up and some upgrades in order to accommodate patients. In terms of moving forward, one of the things Ontario Health is promoting is a seamless hospital system, which means that all hospitals in the region are being treated as if they were one big unit, so that if there's an excess number of patients in a particular region that the hospitals there can't accommodate, hospitals in regions where there is still capacity can take them on. Kingston Health Sciences Center, in fact, admitted its first patient from outside of our region on Saturday, and is expected that's going to continue. It's a slow, steady stream if it does happen, and Kingston Health Sciences is more than ready to look after that. We expect that there'll be some COVID and non-COVID patients coming our way through the pandemic to deal with that. And as you can imagine, if you're living in a region with a high prevalence of COVID and the hospital is full and you get into a car accident or have some other mishap, you would like to know that you can get to your hospital and still be cared for. So there's still a need for capacity in those hospitals to deal with non-COVID patients. And that is why the intent is to redistribute some of those patients so that the whole healthcare system can look after people in their own areas. KHSC has also been appointed as the vaccine distribution center for the region. There has been some news recently in that the Moderna vaccine will actually be allocated out to the 2 health units on either side of us. So Kingston Health Sciences Center eventually will only be looking after the KFLA area. The first supplies arrived last Monday, so sorry, a week ago Monday. And as of the end of the day on this past Monday, 1,956 people have been vaccinated, and that includes in all 3 public health units. The Hastings and Prince and Leeds, Grenville, Lanark, as I mentioned, will be getting the Moderna vaccine, and KHSC will continue with the Pfizer vaccine for the foreseeable future. There is, as you've heard in the news, there's been a freeze on distribution, so it does mean that there'll be a little bit of a hold. So our biggest challenge really is going to be whether or not there's enough supply to meet the objective of inoculating all those in long-term care and retirement homes by the 15th of February. So as we've all learned all kinds of lessons through this pandemic that may not go away after the pandemic is over, things like Zoom calls, for example, the same is true in the healthcare sector. One of the things that happened very quickly, as I mentioned, was this increased level of collaboration. And it was also a lot of getting around the red tape of how things normally get done. There are all sorts of things, as you can imagine, that are in place that prevent full-on easy transfer of patients, for example, and collaboration, including things like how the hospitals are funded. A lot of those things are lessons that have been learned and were very quickly circumvented when necessity required it. And hopefully that will be something that continues into the future. A real significant one is virtual visits. 2 years ago or so, the hospitals started implementing the idea of virtual visits. So physicians were being trained to be able to take patients without actually having them physically in front of them. And it was a very slow process, a very low adoption rate. But of course, once the lockdown came, if physicians wanted to meet their patients, they had to go virtual. And so within a very quick period of about a month, more than 70% of physicians were trained and ready to go with virtual visits. And we now see up to 30% of our patient visits are virtual. Rather than it being in clinics. And this includes virtual visits for simple things like getting your prescription renewed, right through actual clinical visits that in the past, or follow-up visits, which in the past would have been done in a hospital or in a physician's waiting room. So this is a good thing in that it saves frustration and time on the part of the patient. Patients don't have to travel to get to their destination. They don't have to find parking. So it's much more convenient for them. And it's also actually saving time for physicians. More importantly, it also means that it saves infrastructure space. So it means that more of the in-hospital type of clinics can be done there because they're being freed up as people are not sitting in the waiting rooms waiting their turn to see a physician. The other is that we've learned a lot about how infection spreads, and so design features are likely going to be impacted by what has been learned. As you may know, Providence Manor is looking to build a new facility at the Mother House, And they are already looking at rejigging the design a little bit to ensure that their residents can be maintained in pods so that if there is an infection, that does not spread through the entire facility. Similarly, as the KGH tower is being designed, those kinds of considerations are being taken as they look at it. Things like the lab learned very quickly that if they had to adapt, they needed more space, they need for their equipment. And to be able to prevent, for more space generally for bringing in extra staff and for the additional equipment that they might need in order to be able to do that. That's my summary on COVID. In terms of the redevelopment, in 2019, the Ministry of Health actually expanded the scope of what was initially a KGH proposal, and has added some extra floors and inpatient beds to the mix. And it also means that the local share requirement, so that's what we need to contribute as a community to this project, has now risen to 115 million from what was around 94 in the past. Currently, there's a firm by the name of Canon Design that's working with the hospital on what they call the project-specific output specifications, which is, I think, a fancy term for coming up with the basic design elements that will be required to create the RFP to actually hire the firm that's going to do the work. Because this is a design, build, finance approach for this project. So a consortium will have to be selected that can do all three of those things. So they will have to design it, they will have to build it, and through that process, they're financing it. So it means that the hospital only turns over cash at the end of the day when they get the keys to the new facility. Generally, it's going to be mounted in the center of the current KGH campus, which does mean that some other parts will have to come down. There are 4 buildings that are currently there that are no longer going to be once this is completed. That includes Edgerton Hall, the Douglas Wing, Dietary Wing, and Empire Wing. In all likelihood, 2 will come down while half the tower goes up, and then people are moved in. And then the other 2 come down, and then the rest gets built so that it allows some sort of phasing so that there's a place to put people while this is going on. The areas that are being impacted by this are the emergency department, which is going to be significantly larger and make it much easier for dealing with patient inflow. The surgical suites, Sue in her introduction mentioned how our surgical suites are rather ancient. The problem with that is they're also kind of small and the ceilings are too low, so the modern kind of technology that is used in surgery today doesn't quite fit. So this will take care of that problem. Our NICU and labor and delivery will be moving into this tower. There will be the clinical lab will move into there too. So that design feature I was referring to before would be incorporated in here. And then there'll be 2 36-bed medical surgical floors, and then 2 additional floors that are shelved for future use. So this is incorporating the possibility that in the future, well, the likelihood that in the future we're going to need more space. And then pharmacy and the data center will also be in there. You may be aware that the hospitals are moving towards an integrated health information system, and the data center will be in this new facility. In terms of general timing, so we're currently going through that PSOS phase, which will lead to the RFP. The RFP should be issued sometime in the fall, and it'll be a year-long process, roughly, or sorry, a 6-month process, roughly, to get to the point where we are ready to look at bids. And then they will be evaluated, and so by fall 22, there should be a final design, and then 5 years of construction to bring us to sometime in 2028 when the new facility will be up and running. And of course, with the restrictions that the pandemic is bringing, it may cause some changes to this timeline depending on what kind of lockdowns are in effect for construction and those sorts of things. In terms of just rough patient statistics, these charts show the number of patients from Frontenac County that use the Kingston Health Sciences Center. So this does not include Providence, this is just Kingston Health Sciences. So this is the number of inpatients. So 1417 total number of patients in 2020, meaning 1,816 visits, which is a slight increase since 2015. In terms of ER visits, there's also been a slight increase, like nothing major. You'll notice a bit of a dip in 2020, and this is due to 2 main reasons. The first one, people being afraid of going to the hospital because of their fear of catching COVID. Which is not a legitimate fear. So please, if you know people who are concerned about going to get care when they should, let them know that the safest place in the county is actually in the hospital, where all the measures are in place to protect people from the spread of the virus. And the second is that because we're wearing our masks and keeping away from each other, there's virtually no flu this season. So there's a lot fewer visits due to that. And then lastly, this is a graph that shows the use of Frontenac residents in the cancer center. And so here, the number of visits is up by about 15% over the last 5 years. That concludes the formal presentation. Thank you very much for your attention and for your engagement. And obviously, we are going to continue to need to modernize facilities. So once the KGH tower is done, no doubt there'll be a project to modernize the Hotel Dieu facility. There are some ambitious needs here in terms of the 115 million, the local share just for Kingston Health Sciences Center's new tower, but also they have ongoing equipment needs. Providence also has ongoing needs, including the construction of the manor. So we have some challenging times ahead. However, the support of our community has been outstanding, even through the last year where some charities have been suffering from a lack of support. In our case, UHKF is meeting all of its financial targets so far, and I expect that that's going to continue. So with that kind of support, I'm confident that we will be successful in ensuring that our healthcare facilities are up to par and able to look after us all. So I'm happy to take any questions if you happen to have any.
I have to go back to the screen first.
There we go.
There we go. I do want to say thank you, Tom, for that update. By the looks of it, into the future with all of this busy activity, we should be well cared for in this area.
Definitely.
Does anybody have a question? Councillor Jerry Martin?
Yeah, my question is, from North Frontenac Township, the paramedics normally transport people to either Napanee or Perth as an emergency room visit, but from there, they if it's a really a serious injury or whatever, they're transported into Kingston Emerged. How is that coordinated with the Kingston Hospital? Kingston, how do they deal with people coming in from Perth or Napanee? Because that's the route that our people up here in North Frontenac would be taking.
Right.
Is that part of your statistics?
I'm no expert on that, but I could certainly ask the folks over at KHSC how they actually do that. I suspect that there's probably a pretty open line of communication in terms of how the actual transfer happens to ensure that the facilities are there. And certainly, I think through this pandemic, we're seeing that is very important. In fact, KHSC is looking at doing some of their surgeries over at the Napanee Hospital because they've got excess capacity right now for that. So for some obstetrics in particular might be done there. So there's definitely open lines of communication between the hospitals. And so I would expect that's how that actually takes place. But I can get a more accurate answer for you and send it through the clerk.
Well, one reason I asked the question was because you said you had stats there about emergency room visits to
Yes.
KGH. And I was wondering if that was realistic when you consider our people from North Frontenac County go to Napanee or Perth first. I didn't know if that, I know it's a big catchment area, but that was my reason for my question.
Yeah, I suspect that if they don't get moved on to KHSC, then obviously they wouldn't be in those statistics. They would still be in the statistics from those two hospitals.
All right, thank you.
Yeah.
Councillor Higgins?
I have two questions, if I may. You mentioned that the local share is going from 94 million, I think you said, to 115 million. How's that being addressed going forward? Are you going to be coming back asking for more money at some point, or?
There's a good chance. Maybe not for the tower. It may be for the whatever comes next in the line of things that are coming. Currently, we're looking at our capacity to raise the kind of money that's needed through the whole region, of course, not just through municipalities, but through our donors. And we'll probably have a better sense of what that number is in the next few months. We're actually going through a strategic planning process at the foundation. In addition to that, Kingston Health Sciences Center, in order to make sure that that money is there, has also been putting money aside for that purpose. The problem with that is, of course, is that that's money that they could otherwise be putting towards patient care now instead of holding in reserve for some future requirement. And so the more we can raise so that they don't have to put that aside, the better in terms of their ability to provide care today.
Okay, my second question is, this presentation is related to catching up on backlogs. With the province transferring COVID patients to other hospitals such as Kingston, because we're in a green zone and we're getting transfers, how's that going to impact your backlog strategy?
At this point, my understanding that there has been any impact, but the intent is to still maintain capacity. This is where the hospitals are looking at other more creative ways, such as going to Napanee to do surgeries that otherwise would be done at KGH. And it would be the surgeons from KHSC actually going with those patients to do that work. So there's capacity being created in the system through all kinds of creative ways. And as I understand from as recently as yesterday, there has been no talk of canceling anything. Now, there are contingency plans being done in case that happens, but at this stage, there's no thinking that it's going to be happening anytime soon.
Okay, thank you.
Okay, thank you very much, Tom. Is Abigail going to say anything, or?
I was mostly here to coordinate the various participants, but again, just want to say thank you for the opportunity to join you guys today. And again, thank you for your pledge and your commitment to the hospitals.
Thank you for all the work you're doing.
Thanks.
Okay, Brianna, then we will move to Miss Benita McCart from Salvation Army. And my screen says Beverly Harvey, but oh, I guess there we are.
Good morning.
Welcome, Benita.
First of all, I wanted to start by saying thank you to, hello? Are you able to
Hello,
hear me?
yeah, we can hear you.
Okay.
Yep.
So we wanted to start by saying thank you to Frontenac County Council for the opportunity to share our housing programs and what's happening in Frontenac County. We do have a presentation here. Are you able to see that?
Not yet.
Okay. Okay, there we go. All right, there we go.
There we go, yeah.
Yeah, so currently the Salvation Army is providing rural housing services to Frontenac County. And we wanted to begin with a little bit of the background. So first of all, the Salvation Army has been providing housing assistance programs for the city of Kingston for over 25 years. And they've gone through various stages. They've had a loan program, they've had a low income assistance program. And then in December 13, when the city of Kingston approved the housing and homelessness plan, we were awarded the contract in the city of Kingston for the prevention and diversion program, along with the homelessness prevention fund. And we were awarded that through an extensive RFP process. These services, along with the Housing First and youth services, were also provided to the County of Frontenac through Southern Frontenac Community Services. In January 2020, we assumed the responsibility of the rural housing contract through another RFP process. So of course, we provide services to all the areas in Frontenac County, including the north, the central, southern, and also the islands. So that would be Wolf Island and Howe Island. We've set up an office in Verona on Highway 38, and it offers us a permanent location with higher visibility to the community. And we took a lot of time to try to figure out where the best location would be for our housing office. And so once a spot came available right on Highway 38, it looked like that was the right place for us for now. But for those who are unable to access our office, our staff will travel to any area within the county to ensure accessibility to the program. And of course, just saying as same as university hospitals, we've had a number of challenges with the COVID-19 pandemic restrictions, but through it all, the staff have continued to provide housing services while working remotely. So some of the services that we provide are a coordinated intake, a prevention and diversion program, a housing first and rapid rehousing case management, and we also offer a homelessness prevention fund. And we're going to talk a little bit about each one of those elements so that you have a good understanding of all of the services that are provided. Lou McBride is going to actually discuss a few of these slides next.
Okay, so in order to access the services that we have.
We can't hear her. We can't hear her.
Can you talk louder?
All of our.
Nope.
No. Okay, in order to access our programs, everyone, the clients have to go through a coordinated intake process. And this is the first step to accessing your services. And once you go through the coordinated intake, we're able to determine which program that you would be best suited for you, whether you would go into prevention, diversion, or housing first. We get referrals from clients that are referred to us to different agencies.
Benita, I don't
Yes.
want to interrupt, but whatever happened there with your microphone, it's very hard to understand.
Okay. All right, maybe I'll just do it then. Is that okay?
Or switch seats.
All right, we'll switch seats here.
Okay. Okay, so we have the coordinated intake, and that's the first step in accessing our services. That allows us to determine which is the program that's best suited to the person, whether it's prevention, diversion, or housing first case management. So any referral can be self-referred. Clients can just call us directly, or they can be referred through any agency and social services. And we are getting a number of the social services that are referring to us at this time. So we are getting the word out there a bit. So then once we're contacted, an assessment is completed, and that will determine which service is appropriate. So our prevention diversion program is about, well, I guess just as the name applies, prevention. We try to prevent people from losing their housing, whether that's through landlord mediation, tenant education, legal advocacy. We try to help with financial literacy, connect households with any community services and housing services that are necessary. We also can, for qualified households, we can provide financial assistance to the Homelessness Prevention Fund. Those are for people who are not on OW or ODSP, but we can access the funds through OW for people that are on assistance. Okay. The diversion aspect of this program is mostly is about diverting people from using shelter services. So anybody that's assisting households into so anyone in order to assist households to prevent households, those households that are entering homelessness, we try to stream them to alternate areas of accommodations. So we try to, if there's families or friends that they can stay with, or motels, but things that will keep them out of the shelters themselves. And at the same time, we assist them with housing searches and try to get them set up with housing. And for us, the last resort is to actually go to a shelter. If they're homeless, eligible households would be referred to the housing first and rapid rehousing assessment. So housing first and rapid rehousing is a prevention diversion. Usually is a short-term program. We just try to get people back on their feet, get them stable, and then they're done. But with Housing First and Rapid Rehousing Services, it's a longer term service. There's an assessment that they go through to enter the Housing First and Rapid Rehousing, and that determines someone's acuity. And if someone's acuity is high, then they may not have the life skills, or there may be mental health issues or addiction issues that they have to deal with, and it's hard for them to become housed stably. If we got them housed, they might lose their housing within a month or two. So basically, we might stay with the person for 6 months to a year. So basically, it's mostly homeless people that come through this. And the first thing we do is try to get them housed, and we work with the landlord and let the landlord know that we're going to stay with the client. So, if the landlord has issues, they can call us. Then we go on creating a plan for housing stability. Now, each person's individual, so all plans that you create for a housing stability with the client are going to be geared to that client for what assistance they need. If it's mental health issues, we make sure they get connected with mental health services as well. There's life skills that we start teaching, like budgeting, how to pay the rent on time. We try to set crisis plans, especially for someone who's in mental health issues, that they might have a lot of anxiety. And we will create crisis plans, so things that they can do when they fall in crisis, so that they're able to maintain their stability. And basically, it's all about trying to help to teach them how to stay housed. And there are people that have been homeless for such a long term that living in a place of their own, having to pay rent, having to do all this thing is very foreign to them, because for years they've never had to do this. So we stay with them long enough so that by the time we're finished, people are paying their rent on time, they're taking care of their housing, they can get their groceries, they can budget their money. And with the acuity, and yeah, we want to make sure that all of their tenant responsibilities are met. We work with the landlord as well. If the landlord we make sure that the landlord knows that they're free to call us if there's any issues, so that we can, fix that issue as soon as possible. Depending on the acuity, the assistance will last from 6 to 12 months. I think Bev is going to speak to this.
Hello, I'm not sure if you can hear me.
Yes.
Okay, so I'm Beverly. I'm going to talk a little bit about the Homelessness Prevention Fund. I'm the housing coordinator, and as a result of that, I oversee the staff at the Frontenac County office. I also administer the Homeless Prevention Fund. The Homelessness Prevention Fund, of course, provides financial assistance to eligible households in order to maintain their housing. So if people have trouble getting first or last month's rent, or they're in rent arrears, or they're in utilities arrears, or owe property taxes, then we will work with them to help them, if they qualify, to assist them. This is the eligibility income. So households on Ontario Works or Ontario Disability, they would be eligible for the discretionary benefit fund. And if they have trouble completing their application for that, our workers will work with them. To be eligible, of course, it's based on income levels. Like one person is 33, as you can see there, right up to 4+ people of 59.5. So there's a range there which we can help with. Next slide. Who is eligible? Services are available to families, adults, and youth who are experiencing homelessness, or you're at risk of losing your housing. And of course, from the coordinated intake that the workers would do and their assessment process, we would decide what they're eligible for. If they're eligible for the Homeless Prevention Fund, then they would complete the application and we would ensure that the money is provided for them. If there's other ways that they need assistance that have been identified, we will also work through with that as well.
Okay, so.
And of course, this is just an outline of the eligibility process. The first part is coordinated intake, where you identify their needs and assessment, and either they need help with prevention and aversion, which is staying away from the shelter and hopefully staying in their home or finding a new home. And then, of course, if not, and they qualify for the housing first rapid rehousing process, which is the support system totally with them. And of course, despite COVID, we have had accomplishments. We've hired 2 full-time housing staff. And of course, as already been mentioned, we've set up a permanent office located in Verona, which is high visibility for the community. We've connected with a number of agencies and businesses throughout the county and provided program and referral information. We've joined the Rural Emergency Social Services Group. We have a current updated list of local landlords and available listings, but certainly if you know of anybody who could be a part of that list, we would certainly be interested. The households assisted in 2020 through prevention and diversion was 23. Households assisted through the Homelessness Prevention Fund were 15. Households assisted through Housing First Rapid Rehousing were 5. So I think that is a very good success record. Now, of course, we know that finding housing is difficult these days wherever you live, but we certainly do a good part with the community to help our people stay housed. A good news note, though, or story I'd like to share. Our workers were working with an elderly gentleman who needed to replace his oil tank and couldn't afford it on his income and whatever. So we started to research for him and discovered that he was a veteran. So we contacted Veterans Canada, and we're happy to report that he was eligible and he is going to get his oil tank replaced and whatever else services he may need at this time. So we were happy with that, and that just shows that we do aim to research. If we can't help, we certainly will try and find something for them.
So we wanted to talk a little bit about some of our goals and some of the challenges that we have faced over the past year. And as Bev spoke to, it's not only indicative of the county, we find the same thing in the city of Kingston, is the lack of affordable housing. And so we can have all the wherewithal to want to house individuals or to keep them housed, but if we can't find the housing, it makes it really difficult. Another challenge is that we've found that there's no real shelter for homeless. And we're not actually talking just about a physical shelter. We're talking about a lot of individuals don't have family or friends whom they can rely on or depend on in those incidents when they become homeless. The recent fire in Verona lost 28 social housing units, which was a big blow to that community. And of course, the COVID-19 pandemic has really limited our personal interactions with the community at large and some of the programs and supports that we may offer in addition to the housing supports. But, we're looking ahead and we do have some goals. We want to establish a greater awareness of the housing and homelessness programs through ongoing community engagement, such as today. We want to continue building the relationships and partnerships with agencies and local businesses that would help those who need to access our services. And we'd like to look at creating some sort of a housing and homelessness hub that would include sheltering services, mental health, housing and support services that could help bring the community together. So that's our presentation for today.
Okay, if we can go back to the screen and we'll see if anybody has any questions.
Okay.
Does any member of council have a question? Councillor Higgs.
Yes, I can see that these programs are very expensive, and I'm wondering, how do you raise most of the finances to cover these expenses?
So the housing and homelessness programs that we offer are provided actually through the City of Kingston. So the City of Kingston is funding those programs. Yeah, I don't know if the city wants to speak to that.
Well, I see they're next on the agenda. I don't know if they want to do it in their presentation then.
All righty.
Okay.
Checkbook out, Bruce.
You'll get that. Yeah, you'll get that answer in maybe the next presentation. Is there anyone else from council? I guess the only question I have, you said that through the RFP process, you've taken over the whole program. So Southern Frontenac Community Services is not involved in homelessness now?
Well, they're not involved in this particular portion of it, although we do work with them very well and we get a lot of referrals from them.
Right.
So we've
Okay.
established a good partnership with them.
Yep. Yeah. Perfect. Okay, if there are no other questions, then we will move to Mr. Mitch Grange and Miss Joanna Boris from the City of Kingston. Thank you very much for the presentation.
Morning, everyone, and thank you. And yes, thank you to our colleagues at the Salvation Army for the presentation. It's very, very beneficial for all of you, I'm sure. And there is some some duplication in our presentation, so we'll try to go as fast as we can through ours, but to provide you as much insight as we can. So thank you for the opportunity.
Before you started, Mitch, I just did want to say to those from the Salvation Army, thank you very much. There's a lot of information that I didn't know necessarily that was going on in the community in Frontenac County. So that's great. Thank you.
Great, thank you. And thank you to members of council for allowing us to speak today. We really appreciate kind of piggybacking on what the Salvation Army have shared this morning. And we'll touch a bit on the system review that will be taking place, which has already kind of started, but the process and where we're at. So thank you. So this, just going through the presentation quickly, I should say that, yeah, my name is Mitchell Grange. I'm the manager of housing and homelessness for the city. And on the call with me is Joanne Boris. She's a housing programs administrator responsible for homelessness programs. So I'll give just a brief overview of our position at the city and our programs we offer, and then hand it over to Joanne to touch briefly on the homelessness system and review. So next slide, please. Sorry, next slide. So just a general overview. I believe our director, Ruth Nordegraff, had presented a little while ago to council, so not to spend too much time here, but just to, again, to reiterate that we are a service manager for the City of Kingston and the County of Frontenac. And we offer a variety of provincially prescribed programs, so that they're mainly social assistance. Ontario Works is the main program offered at our space at 362 Montreal in Kingston. There's some subcategories to that with some assistance for our municipal residents and discretionary residency benefit to assist with arrears and first and last month's rent deposits, utility arrears. Housing, of course, we manage the centralized waiting list for social housing units as our kind of original mandate as service manager, as housing was downloaded to municipalities back at the start of, I believe it was 2000, 2002. We've now expanded, of course. We have a very robust homelessness service, and we're always trying to create new affordable housing through various programs. And we also offer childcare subsidies to families and the early on programs out of our space as well. So next slide, please. So we do offer all of our programs in terms of housing are under, we have very much a very rigid policy framework. So I'll say that this is an interesting time, a very challenging yet exciting time in housing, where all three levels of government are all committed to housing, and there's various programs coming in. certainly start at the top of the National Housing Strategy, lots of incentives through that for the creation of new affordable housing, modernization of traditional social housing through affordable housing benefits or housing allowances that follow the clients. They aren't unit specific. So we follow a lot of this, the framework that's listed. We have the community housing renewal strategy. We have the 10-year housing and homelessness plan. We just went through a 5-year update to that plan, which is leading into a lot of our homelessness system review we're working on right now. Separately to this, we have the Mayor's Task Force on Housing, which was just completed about a year ago. And now we're working through the implementation plan of that. Certainly we have our council strategic priorities, which one of them is the creation of affordable housing. And we will speak to the homeless system review, which is currently in progress. Next slide, please. So we always like to just share this slide quickly in our presentations. It really gives you a sense of the housing continuum and the services that we offer and how someone would navigate the system from kind of the entry at the first quadrant there of our homelessness and emergency shelters. So you'll recognize a lot of those program names from the Salvation Army's presentation. Our second quadrant is kind of the more along the life stabilization piece. We get into supportive social housing. And as you move along the continuum, we have programs available for affordable housing, affordable home ownership, assistance with low-income households to maintain their units with repairs. And then we move into individuals who are able to support themselves through private home ownership or rentals. So the bottom is speaking to the percentages is about 20% of the population are in the 3 quadrants and 80% of the remainder of the general population are able to sustain their own living. So next slide, please. So quickly on the social housing, that's, as I mentioned, that was kind of the original mandate of a service manager when it came into kind of powers in the early 2000s. Where the city, we now oversee 2,003 RGI units in the city and the county. And there's an eligibility criteria to be able to access RGI assistance. And unfortunately, we have a fairly long wait time for housing. Specifically in the county, we do have North Frontenac Housing Corporation in Sharper Lake, who offer family scattered units. We have Lowborough Housing Corporation in Sydenham. They have 2 seniors buildings. And unfortunately, McMullen Manor in Verona was just, we were just fired there last Thursday, I believe, January 7th. Which every individual living in the space was able to be evacuated, and they've all found temporary housing, and they're very supported. Kingston Frontenac Housing Corporation, in partnership with the fire department and members of your county, members of the general public, have all been very, very helpful in assisting and ensuring everyone has received housing and their supports, medications. So I can say that everyone is doing, well considering the circumstances, and there is a plan in place to ensure that individuals do get permanent housing through, I know there's a partnership happening with North Frontenac. There's vacancies in Kingston Frontenac Housing's buildings as well. We do have the portable housing benefits now as an option where we can allow the individual, provide the subsidy to the individual, and they can seek out a private rental on their own. Next slide, please. So as service manager too, we're always trying to, acquire new sites, divest sites to third parties, create new affordable housing programs. And again, through that policy framework I mentioned at the beginning, that's where a lot of these programs that we run off of have come from. So we have a municipal investment in every year of $1 million. That was through council. And we have these provincial programs that not only offer really millions of dollars in capital funds to create new affordable housing, but also some additional programs for individuals to buy their homeowners, get into, exit the rental market, get into home ownership, as well as sustaining their homes through renovations. Next slide, please. And just on those, these are the first two programs are available in the county. So the home ownership program is for any individual with a maximum household income of $85,000 or less. We would allow them, there's certainly eligibility criteria as part of that. They would apply to the city. We would then in turn deem them eligible. They would secure their financing, and we provide them with a 10% down payment on their purchase price. And in turn, they are to live in this space for 20 years, and then the loan is forgivable. If they move, then there's a repayment. They have to repay us back, repay the city back what we've lent them plus 5% of capital appreciation. There is an uptake in the county for that as well. And then Kingston Frontenac Renovates is really, although it's available to the city and the county, that is really a county-driven program. We allocate $200,000 a year to this program for households within the city or county to complete vital repairs if it's a leaky roof, energy efficient windows, new furnaces, septic systems. They apply to the city. We do an initial site visit, deem them eligible. Out of the $200,000 a year that we have towards the program, with a cap of $10,000 per applicant, we see about $140,000 of that money annually go to the county. We also have a second residential unit affordable housing grant, which is municipally funded. So that is a city program, and that's just for the creation of secondary units built onto existing homes for creation of more affordable rental units within the city. Next slide, please. So this time I'll pass the floor over to Joanne Boris. As I said, she is our housing programs administrator responsible for our homelessness programs. And you will see there is some duplication from the outline that Salvation Army has given, which was great. So I'll maybe ask Joanne just to touch on some of the pieces that that she can elaborate on, and then to the homeless review as well. So thank you.
Thank you, Michael. Mitchell, sorry.
Okay.
Good morning, everybody. Thank you so much for having us and giving us the time to chat with you today about the homelessness programs that we do run within the city and in the county of Frontenac. The Salvation Army's presentation was fantastic in that I think it really gave you a great perspective on the prevention and diversion programs that they run, and also the Homeless Prevention Fund. Unfortunately, there are no shelter spaces within the County of Frontenac, but within the City of Kingston, we do have a number of emergency shelters that are available to all residents, both of the City of Kingston and the county. We have Home-Based Housing, who runs our adult shelter program, and that is for individuals from the age of 24 and upwards, but they will take individuals from 18 and up. That program is on Montreal Street in Kingston. It offers a wide variety of supports for individuals who actually are homeless and are in need of support. So once they're at the emergency shelter, all of their basic needs are taken care of, and they're provided with assessments to determine what their next steps are and how we can assist them in finding and maintaining long-term and affordable safe housing. So they are linked up with Housing First case managers through that process once they're in the shelter system. We also have the Kingston Youth Shelter, and they provide emergency shelter supports and services to individuals in the community that are youth. And they ensure that they're providing the most basic care, supports, and assistance also in finding and maintaining housing. We also have a family shelter for families, and that is also run by Home-Based Housing. They too work to assist families in locating and maintaining safe and affordable housing. And as I'm sure you've all heard, the most recent addition to our sort of emergency shelter system has been the introduction of the Integrated Care Hub. The Integrated Care Hub is a quite unique program in that it really was born from the need to ensure that we had supports for some of our most high acuity clients. And when I talk about our most high acuity clients, that comes out of the assessment process, where we find individuals who may be facing a number of challenges and barriers that make it really difficult for them to find housing and to maintain that housing, but they do need supports in place to be able to begin that journey. So the Integrated Care Hub has become a real stabilization center for individuals who might have some very serious addictions and mental health problems and challenges that might be preventing them from being able to maintain their housing. They're offered case management supports, access to addictions and treatment. There's a nurse that works on site at the Integrated Care Hub who can assist in providing primary care to individuals and making sure that they receive the long-term referrals to the right medical care and support that they might be requiring. There's also a CTS, which is a safe injection site, on site at the Integrated Care Hub, and they're doing phenomenal work as well. So that's the shelter system. Next slide, please. The Housing First program is actually case management supports and systems provided by case managers who will assist individuals from the whole subset that I just talked about, whether they're in emergency shelters or not. They will work with individuals and their budget and assist them in locating landlords that will be willing to rent out their spaces, whether it's in an apartment or a room or whatever the case might be. The Housing First workers work in tandem to help clients find those safe spaces and then stay as wraparound supports for the first up to a year if that's required to make sure that the individual or the family is able to maintain their supports and tenancy. So they can be a liaison with landlords if there's any issues that might come up. They can ensure that individuals are getting the services and supports they need if things start to go awry. They really are that wraparound care to try and make things as easy for individuals as possible. And I have touched on the Integrated Care Hub. So next slide, please. We've provided some statistics here for you from the last year. These are our 2020 stats. So this is both city and county stats. They are all wrapped up into one here. Last year, we saw 110 unique clients that ended up finding housing. From that 110, 89 were adults that were housed. 22 were youth-led households. 20 were the total number of dependents that were able to be housed through the programs. 70 were chronically homeless. And so chronically homeless means that an individual has been homeless for 6 months or longer. 70 total chronically homeless individuals, or 32 episodically homeless individuals housed. Episodic means that they may have had housing for a month or two here or there, lost that housing and come back into the system for whatever reason. And we've been able to work on assisting them in finding more housing and rehousing them. And 69 total high acuity homeless were housed. And those, again, are the individuals who are really difficult to find housing for and may have a large number of acute challenges that they are facing. We were able to house one veteran as well last year. Next slide, please. As Mitch alluded to earlier, one of the things that we've recognized is that the homeless system has now been in place for about 5 years under the Housing First model. And it has been really successful in its infancy, especially in working with those individuals who are most low to moderate acuity clients. They have been housed and we've been assisting in working with those individuals. We saw through the early days of COVID in March and April that we did have an encampment here within the city. And I'm sure you're all aware, we worked very closely with all of our community partners to address the issues and concerns that were coming out and we were hearing from those clients. The city actually went to the encampment on a daily basis. And one of the things that we determined we needed to do was provide a needs assessment to find out if individuals are choosing to live outdoors as opposed to within the shelter spaces or accessing our supports, what might be happening within the system that we really needed to shore up or look at or reconsider in order to meet the needs of all of the clients and individuals within our city. So to that end, we decided to engage with individuals from a number of different perspectives to find out how our services are being delivered, how individuals feel about those services. Are they meeting the needs? And what do we need to do in order to ensure that they are? So we hired an external consultant. We had an RFP or a request for a proposal. One of the main reasons, that we really wanted to do this also is because most of our service level agreements with our funders do come to an end in June of this year, 2021. And so rather than just continue on with things as they are, we thought that this would be a great opportunity to really dig a little deeper and find out, can we make the services more accessible to individuals, and what can we do to support with that? So we have hired an external consultant, as I mentioned, from Insight Consulting. Her name is Pamela Massaro, and she has been working not just with the service providers that we currently fund, but with the clients that we work with, and with the stakeholders in the community that might be making referrals and or working also with the same clients to find out what the needs are and how we might best address them moving forward. Next slide, please. That being said, we are working on a report when the outcome of that review is complete, which should hopefully be sometime mid to late February. We should have a report in place that we will be sharing and that will be made public, that will highlight from a SWOT analysis platform where we might want to go. And then we'll be working with a community advisory community base that we have in place to assist in figuring out if we're going to be repackaging our services, how that might look, how we might best align those services to ensure that individuals are getting the supports they need, and to make sure that we're creating a very holistic and fulsome system moving forward. So we will have more to report back to that to you as we move forward with that process. So that is the current state of our current homeless services. I'm happy to answer any questions that anybody might have.
Okay, thank you very much for the report. Do we have any questions? Councillor Higgs?
With all the numbers that you've shown there that you have helped, are there people still in the Kingston area that do not have a warm place to sleep at night?
Thank you, Councillor Higgs. Yes, absolutely. There certainly are still individuals who are not in shelter, and that is for a variety of reasons. We do have a street outreach team that goes out into the community and works really, really closely with individuals that have been identified as sleeping rough. So we are touching those individuals every single day. There are people dropping by to ensure that they have food, warmth, and are referred to programs and services within the community. Our overall hope is that people will seek out and access supports. However, there are some individuals who choose not to and would actually prefer to be living rough as opposed to being within the shelter system. Everybody that chooses that has their own set of reasons for doing so. And that's really one of the reasons that we're looking at the service review also, is to try and make the services as accessible to those individuals who might have challenges with the system right now, so that we can get them into the right services and supports. I hope that answers your question.
Thank you.
Councillor Higgins?
Yeah, just my question, or not really a question, I just request that when you're looking at going forward and addressing the homeless issue, one of the challenges we have in a small rural community is understanding what the rate of homelessness actually is. Apparently there's a lot of couch surfing going on as an example, and that doesn't get counted in the homelessness. So when the person that wins the RFP process, I just would like to request that the focus be on, not the focus, but consider rural townships and the couch surfing issue that we're, I really don't know how bad the problem is, I guess, is my comment.
Thank you, Councillor Higgins. That absolutely correct. One of the things that that will be coming up in the near future is another point in time count. And the point in time counts are one of the ways that we look to ensure that we are trying to get a handle on the number of individuals that are in precarious housing situations, couch surfing being one of them. The point in time count is certainly advertised for quite a number of months prior to it occurring, so that we try to reach out to as many individuals who are precariously housed as possible, so that they would reach out and let us know of their situations and be counted in that number. One of the other pieces that we have been able to implement just this last year is we are associated with an organization called Built for Zero. They are a national organization that looks to truly understand the real numbers of homelessness within the country of Canada and then drill it down province by province and city by city, county by county. So we've been engaging very closely with them to come up with what is called a by name list. The by name list is actually a real time number of individuals that we know to be homeless within the county and the city. So those numbers are generated not just from the individuals that actually access services and supports, but those individuals that outreach might stumble across, that other organizations that might be closely linked to the funded system but not part of it are identifying as well. So we do feel that we're on the path towards really getting a good handle on the number of individuals who are precariously housed and not just sleeping rough or in the shelter system also. So we're continuing to work very diligently on that.
Perfect. Thank you.
Okay. Well, thank you very much to all the presenters there for all of that information. We really appreciate the update and where it's headed. So thank you very much. At this time, we are going to move into the committee of the whole.
I have it moved by Councillor Higgs, seconded by Councillor Martin, that council adjourn and meet as committee of the whole council with the deputy warden and chair.
All in favor? Carried.
Okay, can everybody hear me? I've got Kelly Pender to give the CAO briefing as the first item. Kelly, are you available?
I am. Thank you, Deputy Warden.
And we don't get to see you.
Perfect. Plans coming together. Thank you, Brianna, for the slide. And as usual, I'll getting some feedback here. As usual, in recognition of your time, if there's anything that I skip over, please ask me to go back or clarify, and I'll try to be brief with your time.
Would appreciate that, Kelly. We went a little over time on those presentations. Yeah. So with the inauguration at 12 noon, some of us are addicted to that as well. So
yes.
We'll keep it going.
I'll be fast. So we'll sum this up by saying it's been a busy month and a half. Thank you. We don't have any update on the funding announcements. We have had several requests from the province for clarification on items, and staff have been providing those, but we don't have any updates in terms of the announcements, though they're anticipated at some point in January. I'd just like to acknowledge the work of the EOWC and the EOLC before we move on. In particular, the EOWC will be meeting this Friday morning to review our long-term care report for Eastern Ontario, and including a detailed summary of Fairmount Home. We hope to have that presentation to this council in February, but it might be March, depending on availability of everybody. And that will be presented to both the multi-ministers on Monday and directly to Minister Fullerton. And it continues to support our position with respect to 4 hours of care, which I think the province is listening to, and shows our position in Eastern Ontario, which again, we're somewhere in the middle of the pack on most of the metrics, as we were with paramedics, but certainly a very worthwhile project. With respect to the Leadership Council, Councillor Higgins continues to be the co-chair. Hope to have our letters of patent for our incorporation at some point in the next few weeks, and there will be another election for an EOWC representative, but continue to work with both the province and the feds on regional economic development issues. Next, please. We'll also be making a presentation to the multi-ministers with respect to the EORN Cell Gap Initiative and the GIG project, hoping to get progress from the province on the GIG project. There has been funding announcements out of the federal government, but EORN isn't eligible for those. So we'll continue to lobby both the provincial and federal government to make sure that we can have a regional approach. It appears, pardon me, at this time that the federal government wants to see smaller, more incremental projects, but those will go largely to communities on the urban fringe, which will make servicing areas of Frontenac County difficult. We firmly believe that the EORN model of doing a regional approach is both cost effective and fair to taxpayers, and we'll continue to make that point. And we have the vice chair of the EORN board with us. Fran, if you have anything further to add, but I think at this point, it's safe to say making great progress on the cell project and should have an announcement in the next few weeks. Next, please. Next, please. Next, please. A number of provincial matters that I think we can skip over, but if there's any questions, certainly available to answer or follow up. The Conservation Authority's working group, and I'm just following up on this because we did pass a motion in support of Cataraqui and Rideau in Mississippi. And the working group has been formed. Joe Gallivan continues to support that on a technical matter. And our primary concern is that work previously done by conservation authorities isn't downloaded to county and lower tier municipalities, and that there is still that regional coordination so that we're not in a position of having to duplicate work that was previously done by the conservation authority. Just a shout out to all of the participating townships. So the 4 municipalities and the county have participated in our engagefrontenac.ca, which is our online engagement platform used by many municipalities in this area: City of Kingston, Town of Smith Falls, prominent. And by doing this together with the 4 municipalities, we've saved a great deal of money and provided one point of entry into the system. So thank you very much to the townships. And we just have a brief overview from Matt Mills, our communications officer, who's been helping with the coordination of this, to give you a sense of what kind of work has been done. Of course, we'll watch the little spinny thing go around. Just a reminder, this is part of our municipal modernization funding and is intended to meet our requirements for capital asset planning and community consultation, but will be used for a large number of initiatives, including planning and economic development. So, well, we're in spin mode. So, no. Can you see it? Brianna and I are just talking back and forth.
I've got bang the table slide up.
Yeah. We're just flipping. There's Matt.
Oh, there's Matt. Hi, Matt.
Caught in mid-word.
He's frozen. Can't hear you, Matt.
There's some kind of background noise going on.
Yeah, and I can't hear Matt speaking, but I can hear some rumbling.
Jerry, it might be at your end. Are you in the office?
Kelly, can you hear us? We don't see Matt any longer. He's disappeared, but he was frozen and we couldn't hear him speaking.
So we flipped back to the slides. We'll send everybody a link. But again, that project will meet our requirements under the regulation for capital asset planning, but will also be used extensively by our townships and county staff for promoting projects.
Is that the bang the table?
It is, yes.
Yes, okay, good.
Terrific initiative.
We'll look forward to the link.
Yes, so just our annual or monthly communications update, continue to increase our viewership on all of our social media channels. Had the paramedic memorial bell ceremony broadcast on the Frontenac County YouTube channel, covered widely by media in Kingston and Ottawa, and a number of different shop local videos, and I encourage you to take some time to look at those. A great way to promote our local businesses, and a big shout out to Alison Vandervelde, who's been leading that initiative along with Matt Mills. Economic development update, the annual business survey targeted 200 responses, and the shop local videos, as I mentioned. Allison continues to work with the local businesses and will be reporting back to CDAC on the results of the survey, which closes on February the 8th. So a couple of announcements. I'll start with the reason why Kevin Farrell isn't here today. Became a father of young Connor Frederick at 4:53 a.m. So congratulations, Kevin and Jess. And Kevin will be off for a few weeks tending to some parental duties, but was a big help in all of our efforts with respect to the Howe Island Ferry and continuous improvement and GIS over the past few months. So congratulations, Kevin and Jess. I'd also like to congratulate Sonia Bolton, who will begin on Monday as our new manager of community planning. And Sonia comes to us from the city of Kingston, where she was a senior planner, and we look forward to working with Sonia. She has lots of experience in both rural and urban planning, and has also experience working with the Bang the Table app to engage the community. So we're quite anxious to have Sonia start. And I was speaking to Megan Ruckwald just before Christmas, and she's enjoying her new job at the town of Arnprior as their planning director. The province did provide funding for dedicated IPAC position at Fairmount Home, and that is Nancy Shillington, one of our registered nurses. And Nancy is busy these days, obviously, also working on the coordination of vaccinations. So the good news is today that last week we began vaccinating long-term care staff at the Kingston Health Sciences Center. And today we begin vaccinations of our long-term care staff. And as of a few moments ago, they were rolling that out, a few minutes behind, but we're really happy to be able to announce that Fairmount Home will receive the first round of vaccinations today, and that the residents will be taking their first step towards being protected from the COVID vaccination. And it'd be remiss if I didn't thank Dr. Moore and his staff at KFLNA Public Health, and of course the fine staff from Kingston Health Science Center. So with that, thank you very much. If there's any questions.
Any questions? Yes, Ron, Warden.
The only, I guess it's a comment. I was talking to somebody in another long-term care home, and they said that the 4 hours of care that the province wants will never be achievable, whether that's staffing or whatever, but they said it just can't happen. Do you think that's a realistic comment or not?
Well, I sit on both the AMO Long-Term Care Task Force and the EOWC Task Force that will be presenting on Friday. And I think saying it will never happen is pessimistic. Do I think it can happen quickly? No, I think both AMO and EOWC are in support of a 4-year phase-in. Our primary concern, which is exactly what we were planning as part of our phase-in, coincidentally, The primary concern has been that there just isn't the staff available to fill those positions. If the province mandated 4 hours of care today, and it doesn't matter where you are in Ontario, the AMO task force, there are people from across the province, and everybody says the same thing, urban and rural. There just aren't enough PSWs, RPNs, and RNs to fill those positions. What the province has committed to doing is to working on training plans to make sure that can happen. So I suspect that their 4-year phase-in window is probably tight, but it's heading in the right direction.
I think Councillor Higgins was first and then Councillor McDonald.
Yeah, just a comment. This presentation wasn't in my agenda package. Just wondering if we could be sent that presentation, please.
I will send you those. Unfortunately, with the new accessibility requirements, we have to work on getting our PowerPoints up to date, and going forward, if you ask for them, we can definitely send them out.
Thank you. Bill, you've got the floor.
Okay, thanks.
Yes, a question for Kelly. Can you hear me all right?
I can, Bill. Thank you.
Kelly, with the Fairmont Home starting to get in the needles for the COVID, what do you feel the time frame will be till a return to normalcy in regard to visitation by outside people?
And that's a really good question. We haven't talked about it at our leadership table, but and I don't want to misquote Dr. Moore, but he's looking at sometime in the fall, and perhaps Dennis can help us with that. Having said that, long-term care will be the first on board, and they're also looking at their caregivers. So I suspect that at least in long-term care world, I don't think it'll go back to normal anytime soon, but it'll be a more family-centric, have you been vaccinated? Are you a caregiver? So I think probably over the next month or so, because it's another 28 days before there's the second round of vaccinations, but perhaps the deputy warden has more from his role with the KFLNA.
Well, we hope to get everybody vaccinated, at least up to the herd immunity level by September. So at that point, I think we could safely let the average person back into long-term care homes. But I'll check further with Dr. Moore. Yes, Councillor Ravel has a question, and then Councillor Martin.
Thank you, Deputy Warden. Through you to our CAO. So I'm very grateful and happy to hear that I presume residents are also being vaccinated at Fairmont Home. What happens over time as the normal transition between new folks coming in? Are they going to be vaccinated before they arrive? And if so, how would that happen? Just because if there's a pool of unvaccinated people within the home, do we not run the same risk that we're currently under now?
The vaccination that started today is in-home for residents. Staff were offered the opportunity to be vaccinated last week at Kingston Health Science Center. And as new residents come into the home, the vaccination will be provided if they haven't already met the criteria. The unfortunate reality is that many of our residents come from an existing healthcare facility where they've already been vaccinated, and they are in the #1 priority group. So they will likely all have been vaccinated long before they get here, but will certainly be vaccinated as part of their orientation into the home.
Thank you very much.
If there's no more questions, we'll move on. Oh, Jerry, I forgot. Councillor Martin, go ahead.
That's okay, Dennis. My question is for Kelly. The staff that were vaccinated at KGH, that's fine, but there's a schedule for staff vaccination today at 12 o'clock and also for caregivers, essential caregivers at 1 o'clock. Is there 100% buy-in from our staff? Like, is it an acceptable buy-in? Can you answer that, Kelly?
Well, and there is a report further on in the agenda to talk about this. So at this point, we're just over 50% of our staff have been vaccinated. And our position with Dr. Pecora from the hospital, and we've also made the point to Dr. Moore, and to their credit, they both acknowledge that vaccinations in the home for staff is the better alternative. I suspect it's going to take us a while to get to levels that we'll feel comfortable with for our flu shot vaccinations. We normally get it well into the 90s because we integrate it as part of their morning screening or as they're leaving, and it's being administered by somebody that they know and work with. So there's a much better confidence level. The difficulty with sending people down to Kingston Health Science Center is that we're telling staff here that they can't have they can't share a Timbit together, but we send them down to Kingston Health Center for 2 hours to go through and sit in a room with a bunch of other people. So there's a certain amount of reticence, which I think we can all appreciate in having to do that. Dr. Pecora has indicated that he is in favor of expanding community vaccinations once there are better options available. Our point is that we don't think we'll meet the same level that we get for the flu vaccination if it continues to be a centralized model rather than a community-based model. And that also applies to our family health teams and clinics throughout the community, where we think that that's a better option for delivering the vaccination.
Mr. Warden, you've got the floor.
I just have, I guess, a comment. I don't know if you can add anything to it, Kelly, but if you have to have your kids and your children and everybody vaccinated to go to school, how come it's not mandatory to work in healthcare providing?
Good question for which I do not have an answer.
Okay.
It was a provincial decision not to force people. But I think in long-term care homes, the estimate is that at least 90% will willingly get vaccinated. So they say you get herd immunity at somewhere over 80%.
Yeah, and I'm quite confident we'll get there too if we can be vaccinating more consistently in the home. I mean, that's what Bonnie, our ROC health nurse, and Nancy, IPAC, and our nursing leadership at Fairmount would prefer, and I think that is the best alternative. And I'm confident that will come at some point. It's just disappointed it didn't start that way.
If there's no more questions, we'll move on. But Kelly, I just want to say we all want to thank you for all the hard work and all the staff at the county. I know we're going through very difficult times with COVID, so keep up the good work.
Thank you, Deputy Warden, and it's certainly not me, and I don't want to forget the paramedics who were assisting with the delivery of the vaccinations today and will be a large part of the community vaccination program as well.
Yes, thank you. And I think we'll move on. We've got a recommendation regarding budget deliberations. Brianna, do you have that one to read?
Yes. So I have the setting of 2022 county budget deliberations and socialization of public input, moved by Councillor Revelle, seconded by Councillor McDonald. Resolved that the Council of County of Frontenac receive the corporate services setting of the 2022 county budget deliberations and socialization of public input report for information, and further that council hold a public meeting on September 15th, 2021 to permit members of the public to make presentations and/or funding requests to county council for consideration in the 2022 budget, and further that the Council of the County of Frontenac confirm the following dates for the 2022 budget deliberations. That would be Wednesday, September 15th, 2021, public meeting, presentations and/or funding requests for consideration in 2022 budget. Tuesday, October 26th, 2021, council presentations, 2022 business plans and project proposals, detailed budget presentation. And Wednesday, October 27th, 2021, council presentations, 2022 business plans and project proposals, detailed budget presentation.
Thank you, Brianna. I've got the October 27th because that's Public Health Day. And I wonder if we could move it back to the Monday and Tuesday instead of the Tuesday and Wednesday. Would that cause any problems at this point? We're still quite a ways out. Kelly or Alec, I guess that would be a question for you guys.
I think from a staff perspective, we'd be fine. It would be a matter for council and your availability.
How about council? Has anybody got a problem with the Monday, Tuesday as opposed to Tuesday and Wednesday?
We have council on the Tuesday, but not till 4 o'clock. So usually our meetings are done by 1:30.
Yes, yeah.
Unlike Dennis, I can't think that far ahead.
And Ron Higgins is okay. So can we change that as a friendly amendment to that resolution?
And sorry, just once again, we're switching the Wednesday, October 27th to what day, sorry?
Monday, October 25th.
Monday, October 25th and Tuesday, October 27th. Just slip them back a day.
Oh, 36.
Any other questions on that resolution? All in favor as amended? Carried.
And just to let you know, I have it moved by Councillor Higgins and seconded by Councillor Smith.
Yes. And the next one is on the user fees. And you have a resolution there, Brianna?
For the 2021 user fees and charges bylaw, I have moved by Councillor Higgins, seconded by Councillor Smith. Resolved that County Council receive the Corporate Services 2021 user fees and charges bylaw report, and further that Council pass a bylaw later in the meeting to impose user fees and charges for services and rescind bylaw 2020-0001, being a bylaw to impose user fees and charges for service.
Any questions on that resolution? It's a standard annual one. Having seen no hands up, I'll call the vote. All in favor? It's carried. The next one is on investment policy.
For amendments to investment policy, I have moved by Councillor Higgs, seconded by Councillor Martin. Be it resolved that County Council receive the Corporate Services Amendment to Investment Policy Report, and further that the clerk be directed to bring forward a bylaw to establish an investment policy attached to this report as Appendix A, and further that bylaw 2016-0001 be hereby repealed.
Any questions? I'll call the vote then. All in favor? It's unanimous, carried. The next one's on the vaccination rollout for long-term care.
I have moved by Councillor McDonald, seconded by Councillor Ravel. Be it resolved that the Council of County of Frontenac receive the Office of the Chief Administrative Officer Vaccine Rollout Long-Term Care Home Employees Report for information, and further that the County of Frontenac requests that Kingston Health Sciences Center and KFLNA Public Health work with local municipalities to implement local options for the delivery of vaccinations to frontline workers and the community. And further that the County of Frontenac express our sincere thanks to Kingston Health Sciences Center and KFLNA Public Health for their leadership on COVID-19 vaccinations, delivery, and pledge, and our support for the program.
Any questions on that? I will call the vote then. All in favor? Carried. And the next one is on planning. We've got a couple extensions for subdivisions. Brianna, the first one on the Sand Road development.
I have moved by Councillor Higgins, seconded by Councillor Martin. Resolved that the Council of County of Frontenac receive the Planning and Economic Development extension of approval of draft plan of subdivision 2292 Sands Road, Township of South Frontenac, County File 10T 2011-002, and further that the Council of County of Frontenac extend the draft approval for the plan of subdivision for 2292 Sands Road, Battersea, to January 29, 2022.
Any questions? Yes, Mr. Warden.
I guess it's more or less a comment or a question through Mr. Gallivan. Is there a way to put a condition in that if this project has been on a file for 10 years or 12 years or whatever it is, that maybe the conditions of the agreement need to be revisited? Maybe the environmental or all of these things are not applicable today. And I'm just wondering if a file sits there that long, how much has changed? That is there a way to maybe incorporate this into planning applications?
Through you, Deputy Warden, can you hear me okay?
Yes, we got you.
That's a good question. It's an interesting question, Warden Vanderwall, because in fact, here we are. It's 8 years since this application was approved, and a lot of the studies are getting out of date. And just for County Council's information, I was working with the Director of Development Services, Ms. Dodds, with South Frontenac on this file. And we were both interested in one of the most important studies of all of our subdivisions, hydrogeological. So we reached out to our peer engineering company, Melrose Engineering, and they confirmed that if the development goes ahead as is right now, as approved by County Council in 2013, then the recommendations of that study are still relevant and not different. It's something that we have had discussions with, because there is some files like this that go on for a long time. And we have made it clear to the applicant that if they come in with any potential changes of this file, they need to be prepared to update the studies. Now, I don't know if I've answered your question, but there is under the Planning Act, every 3 years, there's a maximum of 3 years for draft approval to be met. And then at that point, they have to come back to County Council for an update. And at that point, with staff recommendation, you can decide whether to go ahead or not, depending on how circumstances change. Thank you.
Well,
thank you, Joe. Yes,
just to
Ron.
follow up, I was just wondering if there should be something like in an official plan when they're doing subdivisions like that, if there is a time limit to say after 10 years, all of the conditions would be revisited to see if they're still applicable or if they need to do a study and changes. I just think when it gets that far out, a lot of things have changed. I know it's not fair maybe to the developer, but neither is sitting 10 years.
Through you, Deputy Warden, if you note in the staff report, we do say in the staff report that the planning world in Frontenac County has changed in the last 8 years. Since this plan was given draft approval, we have the county official plan. We've gone through 2 different provincial policy statements. South Frontenac Township has started work on their official plan, and then the open houses, the citizens have said that the citizens right now are saying we'd like to see more development around our settlement areas. We want to strengthen our villages and hamlets. And as I note in our staff report, with communal services potentially coming online this year, there's an opportunity for land such as this within settlement areas to have a different density of development, a mix of housing. And I think that from the county perspective, we would have a problem supporting this very low density development in the future if we get communal services in place. Thank you.
Thank you.
Point. Yes, Councillor Higgins.
Joe, just so I can clarify what you just said. So the Planning Act says it should be implemented after approval within 3 years. Is that correct?
That's correct. And we have that in our draft conditions as well. So the Planning Act says you have to provide 3 years as a period for the developer. It's deemed to be a reasonable amount of time for after they get draft approval, go through the public process, they can implement the conditions.
So in that regard, so this was 10 years old. So we've provided extensions for the last 7 years, including this one. Is that correct?
This is the 5th request. So they got approval in 2016. Then they had the 3-year period to implement the draft conditions, which didn't happen. And then every year they've asked for an extension. And again, as we noted in our staff report, part of the problem here was that the owners of the property, the husband passed away unfortunately early, and the spouse has been trying to sell these lands to a developer every year and has not had an opportunity to do that. But now it's late November. We were contacted by this planning firm, Frontenac, that there is a builder ready to take over this property and start implementing draft conditions. I know that South Frontenac Council had a report in front of them, and Ms. Dodds also endorsed a 1-year additional extension and see if they can actually do what they say they're going to do. I think if this is not concluded next year, then we may be back with a different recommendation to council.
So I share the warden's concern, and I can maybe just a suggestion, and we maybe put a limitation on the number of extensions, like maybe 2. That gives them 5 years to implement. Just a comment.
Thank you. Any more questions or comments? I'll call the vote then. All in favor? It looks like it's unanimous. We'll move on to the next one on Johnson Point.
I have it moved by Councillor Revelle, seconded by Councillor McDonald. Resolved that the Council of County of Frontenac received the report titled Planning and Economic Development, Extension of Approval of Draft Plan of Condominium for Johnson Point, Council File 10 CD 2014-001, and further that the Council of the County of Frontenac extend the draft approval for the plan of condominium for Johnson Point for a period of 6 months to July 30th, 2021.
Any questions? Yes, Councillor Revelle.
Thank you, Deputy Warden. I will be voting against the motion. While I realize this becomes largely symbolic because of the proximity of completion, my vote reflects the position of the majority of our current council that has expressed opposition to this development. Thank you.
Thank you. Any other questions? Councillor McDonald, No, that wasn't a full hand. Councillor Higgins.
Just a question for Joe. We're asking, they're asking for 6 months extension. I just wanted to ask, is 6 months going to be enough if we approve this based on COVID? Just a question for you. Should we be doing 6 months or 12 months?
Through you, Deputy Warden, the developer is very close to finalizing their towards final approval. There's been a couple of court cases that have delayed things. Most recently, the township and the county received clear directions from a court order that only one of the 2 parties can sign the condominium agreement with the township of South Frontenac, and that's been on hold for over 2 years because of some disagreements. But now, just before Christmas, the court ordered that one of the owners has signing authority. That is the last step in the township saying that they've met all the conditions from the township's perspective for draft approval. Once that's done, I'll be working with the Director of Development Services to tick all the boxes off, so to speak. But yes, 6 months is all they need, Councillor Higgins.
Very
just
good.
To respond to Council, can I just respond to Councillor Rebel's concern? When I read through the report, it looks like all the conditions were met. It was just this signing off issue that had to go through the courts that was holding things up. Is that correct?
Joe?
I'm sorry. My apologies. I thought the question was to one of the councillors. That's by and large the main reason. The dispute between the 2 owners and the lack of ability for or the refusal of one of the owners to sign the condominium agreement with the township. But now that's been clearly directed by the court that only one of the owners needs to sign it. That was the major stumbling block.
Okay, thank you.
If there's no more questions, I'll call the vote. All in favor? Opposed? Okay, it passes. And the next one, I think we're going to talk about beautiful downtown Sharbot Lake. And we have a resolution. Or soon to be more beautiful.
I have it moved by Councillor Higgs, seconded by Councillor Smith. Be it resolved that the Council of the County of Frontenac support the Township of Central Frontenac in the completion of an application to the Rural Economic Development Program for the purpose of implementing the forthcoming downtown revitalization program in the village of Sharbert Lake. And further, that the council of the County of Frontenac agree to serve as co-applicant for the project, sharing responsibility for the project implementation. And further, that council allocate $2,000 from the Community Development Reserve towards the implementation project should the said application be successful. And further, that the warden and the clerk be authorized to enter into an agreement with the province of Ontario should the said application be successful.
Thank you. Any questions? Jerry, was that the hand up for a question? No. Okay, I'll call the vote then. All in favor? Carried. And we'll move along to what is it? The annual information reports from the Chief Executive Officer, Chief Admin Officer, I should say. The first one is annual report on delegation of authority. Well, there's a bunch of them. So any questions on those? Okay, we'll move on then to, looks like we got reports from the council liaison appointments, which first is Councillor Higgs on emergency
Yes.
and transportation.
Yes, I'd like to make my report regarding transportation. I heard just recently from one resident that some ferry travelers are refusing to pay the ferry fees. I contacted Kevin Farrell, and he advised me that the county ferry staff have been instructed to record license plates and details for those causing issues. Refusal to wear a required face covering, the intent of which is to keep both passengers and crew safe, particularly during the exchange of money. It is important that passengers abide by the rules as set out by Transport Canada and follow the directions of the crew. We are working closely with Darlene, Rob, to explore the options for addressing and enforcing this problem. That's a report from Kevin. Do you want my report now on paramedics?
Yes, please.
Okay, when I contacted Gail Chevalier, she wrote back to me and she said that orientation continues with the next group of new part-timers, and final group is starting in 3 weeks. There's a total of 14 new part-timers that they have posted the positions for 2 advanced care paramedics and 2 primary care paramedics. They've been posted. Our paramedics have transported a number of COVID positive patients. The correct PPE was used, and no paramedics have acquired COVID-19. There's still concerns about the ability to order N95s through their regular suppliers, and the Ministry of Health will provide emergency supplies when we are down to less than 1 week's supply. Paramedics are to be included in phase 1 of the vaccination rollout, and we are waiting to hear when vaccine will be available in this region. That concludes Gail's report. Thank you.
Thanks very much. Any questions on those reports? We'll move on then to long-term care. Councillor Martin.
I had an update from Susan Brandt about, well, in regard to the vaccinations that were supposed to start this morning at 10 o'clock at Fairmont, and the staff at 12 o'clock in the auditorium, and then the essential caregivers should start to arrive around 1 o'clock for their vaccinations. The essential caregivers, I don't quite understand who that group are. Are they relatives or whatever? I'm not quite sure about that. Other than that, Kelly covered everything else this morning with his CAO report. That's all I have. Thank you.
If I could respond just to Councillor Martin's question, essential caregivers are any individual that the resident has designated to be their essential caregiver. Most of them are typically family members. For those who do not have family members, they could be friends as well.
Thank
All
you,
right, thank
Susan.
you. Thank you.
Next report is corporate services. Councillor McDonald.
Yes, through Deputy Warden. I haven't been able to visit there, but Alex sent me along some information to impart to you that the county offices are closed to the public and most staff have been sent home for the duration of the current lockdown. Some finance, IT, and HR staff continue to come into the offices on as needed basis to continue to support their frontline operations. Operations have been mostly focused on maintaining day-to-day operations as well as performing tasks to wrap up 2020 and get started for 2021. As discussed earlier in the meeting, communications and IT have launched our new public engagement platform, Bang the Table. The new portal shall help formalize and make easier to track and solicit public feedback. That would be my report because I haven't been able to meet in person. Back to you, Deputy Warden.
Thank you. Any questions? Yes, Warden.
I asked the question yesterday whether people needed to work from home, and Dr. Moore said no. So we had a meeting yesterday in our township, and unless it's a child care situation, they are back in the office.
Mr.
In our
Warden,
municipality.
we're using a 50% model here just because we've got some very tight spaces. So for example, both of our payroll people work in the same small office. So on any given day, one of them will be in the office. But basically, we're working at a 50% rule.
Thank you. Any more questions? Okay, we'll move on to planning and economic development. Councillor Ravel.
Thank you, Deputy Warden. Following Kelly's report, I just note that our new manager, Sonia Bolton, will be joining us next Monday, and she has extensive experience in handling some complex planning projects, so that will be helpful to the county. From economic development side, there's been some discussions with some small film productions interested in Frontenac County, and so those leads have come to us from the Kingston Film Office. Several new funding supports have come online. There's a tourism adaptation fund and the Ontario Small Business Grant. And the economic development team has been promoting these opportunities to local businesses. Also, the business survey has been underway for some while. We're hoping to complete the survey by February 8th. And also Richard has been made a number of presentations for the 2020 year to 3 of the 4 townships, and the presentation for South Frontenac Council is scheduled for next week. That's my report.
Thank you. Any questions? Well, we'll move on to the library report then by Councillor Ravel.
Thank you, Deputy Warden. The library continues to provide curbside service and also a warming center for some of the community, I think more in the urban areas. Some changes to Calvin Park hours have come into effect as a result of the lockdown, including closure on Sunday. The rural branches hours will be kept the same. More staff are working from home where practical. And there are still a few tiny details left on the main branch that have been finished. Radon testing in some of the facilities is continuing, and there are Sharp Lake is one of the areas where there is remediation work that was required. It's my report.
You broke up at the end there, Alan, but I think we got the message.
Okay, thank you. That's the end of my report.
Any questions? Okay, we'll move on to public health, and that's mine. As you know, we're back down in the green zone thanks to all the support across KFLNA region, and we're waiting for an announcement from Minister Lecce on the schools. We're hopeful that they'll be opened up in our region on Monday, next Monday. And also, we've been lobbying hard to give us some leeway should the extension for lockdown and the rest of the hot zones in Ontario go beyond February 11th. We're hoping for some consideration that we can revert back to the controls as outlined in the color-coded zone criteria. As far as the vaccine, given everything else is in good order, our focus now at the public health unit is working on rolling out the vaccination to get everybody immunized. The firm schedules are not in place yet. And with this Pfizer production problem, they may have to be pushed back just a little bit for the next few weeks. But our information tells us they'll more than catch up to it by the end of March. And apparently the changes they're making at Pfizer in the plant in Belgium is going to allow them to produce even more. So long term, I think it's going to be positive. Also, there's a lot of work going on the approval of new vaccines, such as that Oxford AstraZeneca, which the UK approved a month ago. So if that comes out, we might have some very good news because it fits the standard immunization process used for the normal flu shot. So we're very hopeful on that. And as Kelly reported, we're moving along very quickly on the essential healthcare workers and long-term care homes. And the tentative plan is to get all of the critical people vaccinated, whether they be essential workers or paramedics or firefighters or whatever, by the end of March. And then we're into the general public, and starting at 80 plus years old, that hopefully will start early April and then go down into the 75, 70 range by later April, and then move on into the younger people as time goes on. We're going to be doing a lot of work on that over the next few weeks, so probably have more to report. And if I should get an updated report on the actual schedules, I'll share it with council. Thank you. Oh, any questions for me? Yes, Warden.
It's just a comment. Somebody made the comment to me to say, what is the point of having statistics in colors when the province does not have regard for it?
That's a question for Mr. Ford, I guess, but we did discuss that with Daryl Cramp, the leader of the caucus, chair of the caucus, and Todd Smith, one of the ministers. And they said the real dilemma is when Toronto was locked down, they had busloads of people going up to places like Barrie, which were open, and that's what they're worried about. So that's the concern. But hopefully, by the time we get into February, that won't happen. We did mention that in the wintertime, you're less likely to get people traveling this far east, as well as none of our popular spots are open in the winter. So for midsummer, it'd be a different question, but in February, March, you're not going to get a whole lot of people wanting to travel anyway. Councillor Higgs?
Higgs or Higgins?
Oh, Higgins, I'm sorry, Councillor Higgins. Sorry.
Dennis, one of the major problems we had with the last ramp up in cases that we just gone through was the Queen's University. When you said that schools are reopening, does that include the universities? And if so, are we going to take tougher precautions on the university students?
I suspect they may be delayed. I think what the minister is going to speak on today or tomorrow is K to 12. I think that's the priority. Queens did send out notification to all their students to please stay home till the end of January. So, and I did write back to the board thanking them for that decision, because we've been lobbying Queens to get more proactive with their students, which is happy because they're essentially on virtual learning. But unfortunately, a lot of the people, even though they're virtual learning, came to the city of Kingston because they already had accommodations rented. So the school is lobbying the students to stay home though during this lockdown.
Thank you.
Any other questions? We'll move on to Councillor Smith on housing and homeless, which we heard a lot about this morning.
I was going to say my report was done very effectively and efficiently by the City of Kingston and the Salvation Army, so I have nothing more to add.
I don't know about the efficiency part, but very effectively. It did go on for quite a while.
There was lots to tell us.
Yes, there certainly was. It was wonderful. The next one is Councillor Higgs on the Food Policy Council. Any progress there?
Yes, Deputy Warden. I'd like to report that the Food Policy Council meeting was held on January the 8th. We had a virtual Zoom meeting. I have mentioned this in my previous report about the Food Literacy for Students Act 216. And as I've reported in the past, these first and second readings have taken place in October. Now the private members bill is carried and now will go to the standing committee for review prior to the third reading expected in the spring. Frontenac County supported this motion at our December 16th meeting. Thank you. The bill aims to ensure that food literacy and skills education be embedded in the school curriculum from grades 1 to 12. The Food Policy Council wished to thank the Frontenac County for their financial support of $500. Letters of further request are being sent to the City of Kingston and Lennox and Addington in the next 2 weeks. The Food Policy Council is sending a letter to the Minister of Agriculture voicing our concern for the lack of abattoir services available to local farmers. And lastly, the City of Kingston horticultural staff have made a decision to grow food in some of their greenhouses as open houses to the public have been canceled due to the COVID crisis. Deputy Warden, that concludes my report.
Thank you, Bruce. Any questions? Okay, thank you. We'll move on to the advisory committee reports. And the first one, we have a resolution for Community Development Advisory Committee. Brianna, you want to?
Yes, I have it moved by Councillor Doyle, seconded by Councillor Higgins, that the report received from the Community Development Advisory Committee be received and adopted, that being open farms in Frontenac 2020.
Any questions on that? All in favor? Carried. And we've got another one on community development report.
I have it moved by Councillor McDonald, seconded by Councillor Smith, that the report received from the Communal Services Governance Operation Model Review Committee be received and adopted. That being the formation of a working group to examine the financial model.
Any questions? All in favor? Carried. And you've got one on open farms to read, Brianna.
Those were the only two that I have on.
Yeah. Oh, okay. What's the one on here?
That was the first motion that we read.
Oh, was it? Maybe I didn't flip over. Okay. And what's next? Return to council? Have we gone through them all?
Yes, I have it moved by Councillor McDonald, seconded by Councillor Smith, that council revert to committee of the whole, council to council.
All in favor? Mr. Warden, it's yours.
Okay. Adoption of the report of the Committee of the Whole.
I have it moved by Deputy Warden Doyle, seconded by Councillor Higgins, that the report of the Committee of the Whole be adopted and that the necessary actions or bylaws be enacted.
Any comments? All in favor? Carried. No notices of motion and no, is there anyone giving notices of motion? Communications, any questions? Any other business? Public question period? You have anybody, Brianna, that's
No, I have no public questions.
okay? Bylaws.
I have moved by Councillor Higgs, seconded by Councillor McDonald, resolved that for the first and second reading, resolved that leave be given to the mover to introduce bylaws A through D and that have been circulated to all members of County Council, and that bylaws A through D be first read as first and second time.
Any comments? All in favor? Carrie?
For a third reading, I have it moved by Councillor Higgins, seconded by Councillor Smith, resolved that bylaws A through D be read a third time, signed, sealed, and finally passed.
Any comments? All in favor? Carrie? Adjournment?
And for
I guess you have
adjournment,
a bylaw?
yes, I have it moved, that was there, so I have it for adjournment, I have moved by Councillor Bell, seconded by Councillor Smith, that the meeting hereby adjourn at 11:43 a.m.
All in favor? Okay, Carrie. If there's nothing else, thank you.
Have a good day, everybody.